Hello! In this video, I'm going to be talking with you guys about the Next Generation NCLEX exam as far as helping you to better understand how to take the test, how to prepare, how to pass your exam so that way you can get your license with confidence. So stay tuned, watch this video until the very end, and we're going to go over it today. All right, so we're going to be talking about the Next Generation NCLEX test, and what I'm going to do with you guys, I'm going to go over and show you screen by screen, and I'm going to essentially show you like how to better understand the test and prepare for the exam, especially if you're not feeling very confident about the exam. And I'm going to give you some pointers, and I want you to really honestly listen really well, because I know that many times when people are taking the test, they feel overwhelmed, scared, and etc. And all sorts of emotions go into place. But you honestly, as you listen to this, listen really intently and try your best to take some really good notes, okay? So we're going to go over this today. So I'm going to be going over with you. I'm working on a book right now, actually. We're going to be going over the Next Generation NCLEX in a lot more detail in this book. This is what the cover of it currently looks like. I'm probably going to change the cover, to be honest. But I'm currently working on this book right now, which is going to be dedicated to the Next Generation NCLEX. So I have some of the book is ready. And what I'm going to do actually is I'm going to go over with you guys some parts from the book. And I'm going to talk into more detail as well, so that way you can really better understand the nature of this exam. So first, let's go kind of into it. Let me see if I can find the correct screen for you guys. Okay, let me go to the very first chapter. Okay, here we go. All right. All right, so here's the thing about the test, and it's not as hard as you may be thinking that it is, although it can feel like it is, but it's honestly about the way you comprehend the material and that you understand kind of like a sequential order to learning the diseases, understanding the drugs, and making sure you get the big picture. If you don't really get the big picture, then this is going to be hard. So what I'm going to focus on right now is specifically pharm and just kind of understand a little bit more about pharmacology. So here's one of the things, the Next Generation NCLEX questions for pharm. It's going to assess your understanding of 1, drug classifications, medication administration, adverse reactions, and patient education. One more time, drug classification, medication administration, adverse reactions, and patient education. You may encounter questions that require you to identify potential drug interactions, assess medication effectiveness, or prioritize nursing interventions related to pharmacological therapies. All right. Once again, you may encounter questions that will require you to identify potential drug interactions, assess medication effectiveness, prioritize nursing interventions related to pharmacology therapies. So here's some things that will hopefully kind of make this a little bit simpler. The first thing is, one of the things I always tell you is that the exam is trying to make sure that you are a safe nurse, okay? So essentially what you have to go in with the mentality is the test wants to see if I'm safe, if I can take care of a patient and keep that patient alive essentially, but the exam wants to see that you are a safe and competent nurse. Not that it wants to trick you, not that it's trying to, give you very evading questions, but instead you have to have the mindset that wants to see how safe you are as a nurse. And so you have to pick answers that demonstrate you understand why you're giving a drug, what is the potential adverse effects from giving that drug, and what would make you say, no, I shouldn't give this drug. No, this drug will have X, Y, Z effect on this type of patient. So when you're learning the drugs, these are the things you have to be mindful of so that way you can recognize this on the questions. What are drug interactions? Drug interactions are going to be what type of meds would conflict, right? So like what type of meds would conflict with that medication that they're already taking? That's one thing you have to think about. So let me write this here. What are drug interactions? Okay, so these are going to be what type of meds would conflict with what they're already on or what they're already taking. And then also this could also be herbs or herbal medicine or supplements. So you have to also be mindful of if the patient mentions, or even if they mention their ethnicity, because sometimes the test will mention the patient has this ethnicity in order for you, and it wants to see if you recognize common medical practices in that ethnicity that may contraindicate any medications that they're on or going to be on. So what are the drug interactions? What would conflict with this drug or another drug, right? When the patient takes the medication, what would conflict? For example, if they are, let's say the patient is on Coumadin, okay, let's say the patient's on Coumadin, and the doctor also wants to put them on another blood thinner medication, such as, well, usually that's the number one medication that we usually give patients on. But let's say they're taking Coumadin, they're taking warfarin, and so then we're also concerned that the patient recently was in some type of accident, or we're concerned that the patient is going to start taking, I want to say it's either garlic or ginkgo biloba. And those type of herbs, when taking it together while they're also on Coumadin, can affect the potency of Coumadin. So these are some of the things you have to think about. Medication effectiveness as well. This is going to be how well is the medication working? Is the medication giving the ideal therapeutic effect? Right? The reason why we gave it is to do X, Y, and Z. Is it producing that ideal therapeutic effect? And so there are usually certain parameters or certain signs and symptoms that we look for to identify this. So for example, if it's a blood pressure medication, right, it's effective. We know it's effective if the patient blood pressure becomes to the normal limits, right? We gave it because it was out of normal, and now it's within the normal limits. Pain medication, we gave them a pain med, and so now as a result, after giving it, their pain is reduced or gone, right? Those are simple examples of medication effectiveness, okay? And then as well, the other thing too is to be able to prioritize nursing interventions related to pharmacology therapies. So one common thing that you'll have to prioritize is monitoring specific lab values, right? So there's specific lab values that some meds you need to be more mindful of, right? So for example, with the Coumadin or warfarin example, we have to pay attention to their INR levels, right? And usually when we're giving that to them every day in a acute care like setting, that INR level has to be monitored daily. All right. So these are examples of things that you need to be aware of when it comes to pharmacological therapies. Then the next one, okay. And if this is helping you, please let me know by leaving a comment or a thumbs up on the video, etc. All right. Then the next thing is pharmacokinetics. All right. Pharmacokinetics. If you can describe for me in the chat what you think pharmacokinetics is, go ahead and put it right now. All right. If you believe you have an understanding of pharmacokinetics, comment below. Let me know if you understand what it is. So pharmacokinetics, pharmacokinetics refers to the study of how drugs move through the body. It encompasses 4 essential processes: absorption, distribution, metabolism, and excretion. One more time, pharmacokinetics refers to the study of how drugs move through the body. It encompasses 4 essential processes: absorption, distribution, metabolism, and excretion. All right, those are the 4 main elements behind it. So here's one of the things about this, because sometimes we'll learn stuff, but we don't understand how it's actually applied in real life. And this is, your understanding of pharmacokinetics is really, really important, because if you don't understand it, then, and how we implement it and the safety behind it, then you're going to struggle with pharmacology and pharmacology-like questions. So you need to know this, because the way that a drug goes through the body, that influences why we give them the drug in PO form by mouth, in IV form through the IV, right? IV push or IV piggyback, in sub-Q, right, through their fatty tissue, or IM in the muscle. So understanding that is so important, because especially depending on the nature of the drug, if you give a specific type of drug in a specific route, then the effect of that drug is going to work a lot faster, and it's going to be a lot more potent. That's why you can cause a med error. That's why if you give a drug, if you don't really pay attention to that route, that's why a patient can have an adverse effect or a life-threatening effect or potentially die, because it matters the route. So for example, insulin, right? Insulin is supposed to be given subcutaneously, right? Through the fatty tissue, and usually we give it in their stomach and etc. And then it works within about 15 to 30 minutes, and the peak varies whether it's like Humulin R or MPH and etc. Right? So 15 to 30 minutes, 30 to 45 minutes, it varies depending on which type of insulin, right? So, but the thing about it, and usually we give it because the patient's blood sugar is elevated, right? So if you was to give, let's say it's 10 units of insulin. If you was to give that same insulin through, for example, an IV line versus in their stomach, in their fatty tissue, it's going to work within minutes, within a couple of minutes or less. And it could cause the patient's blood sugar to drop rapidly, which would cause a very severe hypoglycemic effect. That's why we don't that's why it's not a light thin, oh, just give it PO, oh, just give it IM, oh, it's okay, give it sub-Q. No, it is significantly important which type of route you're going to give the medication through, right? So you need to be aware of that. And that's what pharmacokinetics is. That's the movement, the distribution, the absorption, the metabolism, and the excretion of the drug through the patient's body. Hey there, this is Nurse Choma. Do you need help to pass your NCLEX exam, especially your RN test, and maybe you're nervous about it when it comes to passing the exam, taking it with the Next Gen test, and maybe you tried it before and haven't been successful? I want to invite you to attend my upcoming 6-week NCLEX RN review. This is going to be a great virtual online review class for the next 6 weeks, where I'm going to show you how to take and pass your NCLEX exam. During this review, we're going to go over content. I'm going to show you how to think more critically. I'm going to teach you and help you to realize why you may not be passing your exam, especially if you've been struggling before. In addition to that, while you're a part of this program, you also get access to an online library, and in that online library, this is where you're going to get more content, review, as well as also assessments and practice questions and next generation-like questions as well, so that way you can further boost your confidence to taking your exam. So this is inclusive for everybody that attends the class, all right? You're also going to get homework as well. It's going to be a great opportunity so you can really feel confident. And the great thing about what I do, I've been doing this now for several years, since 2015, and we've seen a lot of amazing, successful stories of people who have finally passed their NCLEX exam after struggling before, people that felt unconfident, people that were nervous to make an investment, but they made the investment, and now they are living their dreams as a registered nurse. So if that sounds like you, go ahead and click below and register right now so that way you can be a part of this amazing live training where you're going to learn how to pass your exam so that way you can go on and live the career that you desire to live. All right, see you in the class.